My presentation is on Chapter 22 and 24, which is Disruptive Staff and Workplace Violence. So the goals of this presentation are to be able to define workplace violence, to identify workplace violence, how to end workplace violence, also to define disruptive staff, identify the qualities and acts of disruptive staff, and also how to handle disruptive staff. So if you currently work in healthcare, I'm sure you've heard of workplace violence. Workplace violence can be defined as any violent act, including physical assaults and or threats of assault directed towards persons at work or on duty. In healthcare, the vast majority of attacks are initiated by patients, but attacks can also be made by family members, coworkers, employers, and even colleagues. Now that you know what workplace violence is, I think it's important to know the different kinds of workplace violence. Workplace violence can include threats, physical attacks, violent assaults, and or verbal or written threats. A couple examples of threatening includes waving your fists, throwing objects, and even threatening body language. Physical attacks are anything physical, such as slapping, hitting, biting, shoving, kicking, pushing, and or beating. Violent assaults include rape, homicide, and attacks with weapons such as knives, firearms, and bombs. And yes, verbal and written threats count as workplace violence. In healthcare, we love to have statistics on what we are talking about. We love to have proof behind what we're presenting. Unfortunately, this set of statistics is not a good one. In 2018, nurses were surveyed on workplace violence. Of those surveyed, 9% experienced physical violence, almost 53% had suffered verbal abuse, and 12% reported they had been sexually harassed in their workplace within the 12 months leading up to the survey. No individual should have to go to work every day and worry about whether they're going to be physically attacked, emotionally abused, threatened, whatever the case may be. There are two different spectrums. It can be from colleagues and coworkers or from patients. If the violence is coming from coworkers, colleagues, other employees, there needs to be a zero tolerance policy for staff that if violence occurs in the workplace, regardless of what kind of violence it is, that individual needs to be getting rid of. We need to be encouraging our employees to report incidents of violence, whether it be from employees, coworkers, patients. There needs to be clear procedures for reporting incidents, and it needs to be emphasized that you're not going to get in trouble for reporting these incidents because, of course, we don't want our employees to be exposed to that kind of environment. We need to also educate employees on the assessment of situations and the warning signs of violence. So we need to be looking at how to de-escalate violent patients or patients that are getting agitated. We don't want them to get to that violent stage. Also, there needs to be an established training program for healthcare workers on how to handle workplace violence. So disruptive staff is pretty much just how it sounds, staff that are disruptive. They can be disruptive in a variety of ways, such as bullying, lack of civility, as well as horizontal violence. Bullying is the typical stuff that we used to have to deal with in high school, such as ignoring, condescending, isolating, hopefully not, but possibly physically attacking, harassing, and ridiculing. Lack of civility can be just that individual who's really rude, disrespectful, impolite, as well as horizontal violence, which is harassment between employees of equal rank. I remember back in high school there was a really big push to recognize bullying and ultimately end it. Bullying in high school led to kids not wanting to come to school, to have that really negative outlook on the whole school experience. It was just miserable to be that kid that was bullied. Unfortunately, bullying does not end once you get out of high school. It kind of carries over sometimes if you have these kind of disruptive staff members in your employee pool. It works the same way. Bullying leads to staff dissatisfaction and increased turnover rates. Unfortunately, in nursing, when you have increased turnover rates, you don't have an adequate number of staff. When you don't have an adequate number of staff, you have a lot of patients for one nurse. And that's not fun for anyone, and it's also unsafe. So these disruptive staff threaten the organization's ability to provide that appropriate care and maintain those high standards of quality as well as patient safety. So next is how to handle disruptive staff. This can be a little bit challenging because they always enforce to us that, we want to use the chain of command. So we want to try to talk to that person first, try to work out our differences, but there are those individuals who there is no talking to them. When it comes to a certain situation, it does have to be addressed if it interferes with patient care, patient safety, those kinds of things. When a problem arises, it does have to be recognized and addressed right away. Otherwise, that individual who is causing a problem could think that behavior is okay and keep up with it. So the manager who is addressing these disruptive staff members, they have to be persistent and consistent with the employee. Otherwise, they may think that activity is okay and cool in the workplace, but it's really not, because it's making everyone miserable. But of course, there are those individuals who just do not understand boundaries and consistently are a problem in the workplace. So despite being coached and disciplined, those people just don't get it, and they are classified as marginal employees, and eventually they could be let go from their position because they do cause such a rift in the pool. So a little branch off of the disruptive staff, substance abuse. Substance abuse in the workplace is definitely an issue in today's society. Pictured is Nurse Jackie, which is a favorite show of mine, but it definitely highlights how substance abuse can affect someone's work, and in nurses' cases, place both the individual abusing and the people that are being cared for at risk for harm. Substance abuse can include drugs and or alcohol. Anyone can be affected. It's not limited to family history, prior medical history. Of course, those things put you at a larger risk, but a couple different signs of dependency are frequent complaining, increased illness, increased isolation, of course call-offs. If you think a employee, coworker, colleague, whatever, is displaying some symptoms of dependency, you can look for shakiness, slurred speech, sweating, unsteady gait, nausea, vomiting, diarrhea, weight loss, even blackout. If you think someone is abusing, you need to report that. It may be really hard, but you cannot let that person be at risk or the patients they're caring for be at risk. You need to immediately report that and get that person off the floor and not interacting with patients. Consequences do vary from state to state. but there's a lot of good programs to get people the help that they need. So that was my presentation on disruptive staff and workplace violence. I hope you guys learned something. I'm going to attach these YouTube videos because I'm a little bit technically challenged, but I'm going to do my best. They're really good, so take a look. I hope you guys learned something, and thanks for watching.